October is Breast Cancer Awareness Month, and there's usually an increase in mammograms during the month. But mammograms can fail to detect tumors in some women. In tonight's Health Watch, CBS's Roxana Saberi on what women should be asking at their next appointment.
For many, the key to beating breast cancer is early detection. 48-year-old Eve Feinberg gets a mammogram every year.
My two paternal aunts were diagnosed with breast cancer. I have always lived with this fear that I too will die of breast cancer.
Her physician, Dr. Sarah Friedwald, says Feinberg is also at a slightly higher risk because her breasts are dense, meaning they have less fat and more tissue, like the breasts in these images.
About 40 to 50% of the women in the country actually have dense breast tissue. It just makes it a little bit harder for us to find cancer on the mammogram.
That's because dense tissue shows up white on mammograms, and so do tumors.
On a very cloudy day, which would be similar to a woman who has very dense breast tissue, we really can't see the cancer.
She showed us how, for this patient, additional scans, an ultrasound and an MRI revealed a large cancerous mass.
The area lights up very quickly.
38 states now require patients to be notified about their breast density. And the FDA is planning to announce regulations on informing women about their tissue type and screening options. Patients should ask their doctor about their tissue type, and if additional tests are needed, make sure to get a medical order and check if their insurance company requires pre-approval and covers the cost, ranging from a few hundred to thousands of dollars. Feinberg told us she pays around $2,000 out of pocket each year for an MRI after insurance coverage. But she says it's worth it.
I think just to know that if something is detected, it will be detected at an early stage.
Only 16 states and Washington, D.C. require insurers to cover additional imaging. But if breast cancer is caught early, the 5-year survival rate is 99%. Norah?
Roxana, thank you so much for that great reporting and information. It is such an important topic. I actually went today to get my mammogram and sonogram. It took about an hour and a half, and while not comfortable for a few minutes, we all know this can save lives. So tomorrow we're going to take a look at the racial disparity, the survival rate for women of color, which is much lower than for white women. Why is that, and what can be done? That's tomorrow right here.